I'm Dr. David Booth. I've been a dentist in Perth for over 50 years. Since I retired, I founded the dental volunteer group called CHAT. We treat poor patients in Vietnam, and we're now in our 10th year.
The aim, I guess, is not just to provide dental treatment to underprivileged kids, but to express a love for their neighbours in the sense of those in other countries like Vietnam that don't get that kind of treatment.
We've divided up into 3 groups to get ready. One group works with the handyman to check that the dental equipment is all working.
So most of the units they would be donated by dentists or the public health system in Perth, and they're usually ex-units, so they'll be 10 to 15 years old.
There's another group going through the children's bags. And school children in WA donate the bags and colour them for us. We've got groups of ladies knitting teddy bears around the country, and Colgate and Oral-B are very good at giving us toothbrushes. Vietnamese children don't like the taste of Australian toothpaste, so we buy toothpaste over there, and this is a great thrill for the children where very often it's the first time that they've had a present just for them. And the third group works with the head nurse.
We're checking the stock just to make sure that we've got enough stock for the 5 days that we're going to be away.
Okay, we're on the bus now, on our way from Ho Chi Minh City to Can Tho. We're going to stay each night at Can Tho, and we'll go out from there to the smaller villages. We're now a recognised NGO, so the government finds the poorest people of the area for us to see. On this day, the pop-up clinic used a spare room in a hospital in the village of Viet Trang. The pop-up clinic is made with whatever is available, and we turn the site into a dental clinic in a matter of minutes. We go to Vietnam now 4 times a year, and there's about 15 of us go from Australia, 4 or 5 dentists, sometimes a hygienist, and dental assistants, interpreters, and helpers, and a doctor. We incorporated the opportunity for final year dental students to come as an elective. They do treatment under supervision. They also carry out dental health education.
Vivian and Sam just teaching them, showing them how to brush their teeth, and then the techniques of doing that, and then exactly how many times they have to do. They brush their teeth during the day.
This is the triage station where we first see the children, and we get their name and age, listen to their heart, take a medical history, and I look in their mouth to see what they need. If I found that they need antibiotics, we dispense those. If they need painkillers, we dispense those as well. And then we can send them on to the dentist who will do the treatment. With the prosperity of Vietnam improving, unfortunately the amount of sugar the children eat, and therefore the amount of decay that they have, increases as well.
most of the treatment involves extracting really heavily decayed or infected primary teeth so that it's not going to interfere with the development of their adult teeth. Apart from that, it's a lot of preventative fillings that we're doing.
Kieran's doing an extraction on I think a 3 or 4 or 5-year-old boy, anterior teeth. So I'm just getting the forceps for him.
In about 1 to 2 years.
Khoảng 1 hay 5 sao á. Just helping the parents with the kids with the language because Karen wants to explain to the parents what happened to the children's teeth and what are they going to do.
We treat them under local anaesthetic, which involves giving them an injection in the mouth, usually close to the tooth. We would organise for the child to have a general anaesthetic. It's very often the first time that they've had a local anaesthetic, so we have to explain to them exactly what we're going to do and why, and how their mouth will feel different.
So we had to take all 4 of his top teeth out. He was about 5 years old, and so those teeth had become really infected. It had gone into the nerve, and then it had caused an infection at the root of the teeth. So if he left those in, the infection can cause problems with his adult teeth. And so we just take it out, make sure all the infection's out and everything, and then just see how it goes from there. Generally, it's like when they're brought up, they don't understand oral hygiene that well. So it's probably a combination of not brushing his teeth or anything like that. But then also things like when people come along and families they want to look after them, so they give them condensed milk and sweets. And so the combination of both, probably the lack of education as to diet and oral hygiene contribute to that.
Here it's like have to do as good a job as you can as you do in Australia, and you've got no time. The equipment's all different to what you've used. Sometimes instruments are blunt, but here it's like you feel a lot more emotionally connected to these ones, these little kids.
The best part about volunteering is the feeling that you're doing something that is really worthwhile. These poor children do have such terrible teeth.
When you see little kids on the street, you don't give them lollies or you don't give them money. That's not going to help them. It's all about doing activities like this that can actually create awareness for them.